Like, what's better than being the dean of Stanford Med School? The dean of Stanford Med School right now was Casey's same specialty, head and neck surgery. And the way you rise up in medicine is you do a specialty, you focus on, a couple inches of the face, and then he focused on a fellowship on an even narrower part of the body. Like, that's how you rise up. You've siloed the situation. Anything that's not siloed is considered not scientific, is considered wacky. They've called us the woo-woo caucus, talking about these nutritions. The medical system enforces this siloed view where diabetes, heart disease, depression, kidney disease, cancer, they're all separate things. If you have those conditions, you're seeing 5 separate doctors, they aren't speaking to each other. That's very profitable, very problematic. So the solution is truly just having the clinical guidelines of how diseases are assessed and how they're intervened changed to following the science, which is these are metabolic conditions. 90% of the U.S. medical budget is tied to managing preventable and reversible lifestyle conditions. If we had people on Medicaid, instead of jamming with the statins, jamming them with Ozempic, jamming them with SSRIs, lower income people, we're going bankrupt from Medicaid, $1.3 trillion, it's growing, it's a bigger part of the budget than the defense budget. If we literally just asked, how do we have that money to spur thriving, to incentivize exercise, to incentivize healthier food for these folks, we'd be a transformed country. It's literally that simple, but it takes that moral courage. It takes Americans actually saying, no, I am going to go against the NIH. I am going to ask questions. But of course, we have violent, just reading, back, was it 2022? Like every single public health official in America said you were like the enemy number one for talking about sunlight and talking about food and talking about healthy eating. COVID was a metabolic condition. COVID was a foodborne illness. Like if you were metabolically healthy, you did not die of COVID, like pretty demonstrably. And you were threat number one.
Go ahead.
Yeah. No, I think Callie's getting into something also that I think is part of the reason why. I mean, fortunately, there are a lot of doctors speaking out right now, and I have so much gratitude for all the other, not only doctors, but NPs, DOs, chiropractors, nurse practitioners, all these amazing people who are speaking up and getting a lot of shit for it. But this is very tribal, and I think that when you think about, and it's hard, this is a primal instinct to not break out of the pact and to not go against what the norm is. So I think in a lot of ways what we're dealing with here is going to come down to how courageous are we willing to be to move humanity back, and by humanity very much also the Earth's health, because they're interconnected. They're one and the same. How courageous are we going to be to stand up for that, or are we going to let things slip through our fingers? And I think the tribe, when I was in medical school, it's amazing because of the interest and the fact that, Stanford got a $3 million grant from Pfizer while I was there to revamp the curriculum, and the fact that the American Diabetes Association that makes clinical guidelines is getting millions of dollars from Coke and Cadbury, and the American Diabetes Association is getting millions of dollars from Mead Johnson that makes formula, and Abbott Nutrition that makes formula, and vaccine companies that make flu vaccines. The fact that the money, 8,000 major conflicts of interest were just reported at the NIH with food and pharma. So at every level, the medical guidelines that if you step out of, you are at risk for litigation as a doctor, and the NIH, this thing that we all respect, tons of conflicts of interest, and the medical schools accepting money. The tribe that then you become a part of as a trainee is a tribe that only hears one thing.